In virology expert, that's Professor Barry Schoub, as we continue this conversation unpacking this announcement. Prof. Shube, I'm not so sure how much of that interview you had with the minister. I know you are part of the think tank nationally around this whole issue of how we've been managing COVID-19. Just first up, your reaction to the fact that we are here today, no more COVID-19 restrictions.
Yes, good afternoon, Dan, and good afternoon to the viewers. Look, I think it certainly is very good news for the economy, and particularly certain sectors of the economy, the tourist industry, the catering industry, the entertainment industry. They are certainly, it's good news because they've really kind of taken quite a whack with it with COVID-19. So for them it is. But I think I listened to the last part of the minister's interview, the Honourable Minister, and I think he did make a very good point, and that is that the fact that you can legislate that these regulations go away doesn't mean that the epidemic is going away or the pandemic is going away. The virus is still with us. And I think we've got to think smartly. I think we've got to behave smartly and intelligently. And if there are high-risk situations, like, for example, in a closed environment with poor ventilation, then we do need to kind of take the precautions of wearing a mask in particular. And particularly if there are vulnerable people, elderly people that are around. So yes, basically, I think for the economy, it certainly is good news. I think that we are following many countries overseas, European countries and North American, so which have also similarly lifted all the restrictions. But I think we still need to be wary that the virus is circulating. It is still present at the moment.
And therefore, if you have not vaccinated, or you can get a booster, do so.
Absolutely. I think the vaccination, as the Honourable Minister said, is really an essential component of public health, essential public health measure to take to prevent infection and to stop the virus circulating in the community, because that's the danger. We don't want the virus still circulating in the community, picking up mutations and then generating more variants and giving us another wave, a sixth wave, further down the line.
Yeah, we are here, Prof. Shube, and if you look at the numbers, the metrics, everything going down, because maybe of efforts or because of the levels of immunity. What, in your view, has contributed to the status quo in terms of the coronavirus in our country today?
Yeah, I think this virus, like many other respiratory viruses, also goes through periods of waves. There's an increase of infections, the population develops an immunity, and then the infection comes down. So we have upward trajectories of the wave coming down in the trough. And at the moment, we're at the bottom. We're at the trough at the moment. In other words, low activity. But we do expect that there will be waves in the future. What we don't know is exactly when it's going to come. We can think more or less, if it follows the same cyclical pattern, we can expect a sixth wave maybe 2 or 3 months from now. How severe it's going to be, again, we really don't know. This virus is an uncanny virus. First of all, it's a virus which is a supreme master, a supreme escape artist, and it evades the immunity of the population. So it's going to be quite transmissible if it does develop that characteristic. And also how severe disease is going to cause that, we really can't predict at this stage. So we do need to be wary, we do need to be vigilant in this low period where we are at the moment.
Yeah, a friend of mine said coronavirus is like a virus on steroids. Now, the issue of not knowing the future, being mindful as well. Sometimes when you get the news about like monkeypox, which is another virus, people are saying, oh, we are in this world that is full of viruses. Now, as a virologist, are we doing enough? Are we doing well enough as South Africa? Because we have been praised, you yourself and your fellow scientists, for our work in terms of tracking the variants of coronavirus. The last we've had was Omicron, and then we heard about the sub-variants of Omicron, and that it's mild and moderate. As you know today, Prof. Shube, we don't have any more variants currently that are being tracked or that could become variants of concern?
Well, Dan, I think you hit on a very important point, and that's surveillance. We've got to have a system where we can pick up the variants as early as possible, so we can kind of put measures into place. So we might need to reinstate some of the restrictions. But the idea is to kind of pick them as early as possible. Fortunately, we've got a very, very good, what we call a genomic surveillance system in the country. It's the virology laboratories around the country which are continually monitoring viruses from either clinical cases or even from wastewater, because, you know, it is excreted in the stool. And hopefully they can pick up these mutations as early as possible to be able to respond as early as possible with the public health measures which are needed. And this is part of a global surveillance system all through the world. And I think this is just so essential for public health, to be able to have this monitoring system to pick up these things as soon as possible, as early as possible.
Yeah, and now that we have the first case of monkeypox detected in Johannesburg, I guess there's going to be more. According to the minister a short while ago, they have to test the persons in that home or around that particular person and do some tracing and saying, but our system, from what you've just said, has got this beautiful ability of surveillance currently, as we've known. What did you call it? Genomic surveillance?
Genomic, yeah. It surveys the genome. The genome is the genetic material, the nucleic acid of the virus, which gives the virus its properties and its characteristics. So these changes, what you call mutations, are what generates these variants and these subvariants.
Yeah. Is it normal for monkeypox to be in Johannesburg?
Well, you know, it is spreading. Fortunately, it's not nearly as transmissible as, for example, COVID is or influenza is. It needs very close contact with somebody that is infected. But it is people that do come into close contact with somebody that is infected. Fortunately, one can recognize it because it gives a rash, a very typical rash. It's actually very related to the old smallpox, which we eradicated at the end of the 70s. But it is a related virus, fortunately not nearly as severe a disease as smallpox was, but it is a similar kind of virus. And one of the advantages, I shall say advantages from a medical point of view, is that it can be recognized quite early, and therefore that person can be isolated. They need to be isolated for a longer period of time than COVID, for about 10, 14 days. And in that way, one can try and stop it. But it is spreading, unfortunately, but not nearly as rapidly as COVID did.
Okay, thank you very much, Professor Barry Schoub, for your time and some insights about this world of viruses as the South African government lifting the last part of the restrictions of COVID-19, such as the mandatory wearing of masks. It's no longer there. Gatherings are no longer limited. And also when you travel, you don't need to do a test before you travel, and you don't need to produce a vaccination certificate. Those were three specific sections of the health regulations that the minister repealed with immediate effect last night as gazetted.